Are you at risk for developing type 2 diabetes? What's the chance that you'll have a heart attack some point in life? We can determine some of these things by looking for metabolic syndrome. My name is Kate, and let's talk about what metabolic syndrome is. Metabolic syndrome is a group of 5 risk factors we often get measured at our doctor's office or if you do a screening with us at Rock Valley Health. And if 3 or more of these factors are positive, you're at an increased risk for heart disease, type 2 diabetes, stroke, and certain type of cancers. The National Institute of Health, the American Heart Association, and many other health organizations use the metabolic syndrome to help people determine their risk factors for many of the diseases we find here in the US. So what are these 5 factors? High blood pressure, high fasting glucose, high triglyceride, low HDL cholesterol, and a high waist or large waist circumference. So there are no symptoms of metabolic syndrome. You won't feel differently when you have it. So most people don't know they have it, but 23% of us do, according to the American Heart Association. And those that do have double the risk of heart disease and are 5 times more likely to develop type 2 diabetes. Being overweight, obese, or having a lack of physical activity are large factors in the development of metabolic syndrome. So it's a good conclusion to say that a healthy lifestyle is the best prevention and treatment of metabolic syndrome. Let's look a little more closely at each of these 5 risk factors. We'll start with high blood pressure. High blood pressure is determined by a resting measurement of 130 for the top number or higher, and or a higher number than 85 for your bottom number. If your blood pressure is high, over time it's putting extra strain on your blood vessels and your heart. The extra strain on your blood vessels can lead to clogged arteries. It also can lead to weakening of those blood vessels, increasing your risk for aneurysm. The extra strain on your heart can weaken your heart muscle over time, making it harder to pump that blood out to the rest of your body. High blood pressure also increases your risk of dementia and kidney failure. High fasting glucose or high fasting blood sugar is a reading that is at or above 100. Does not mean that you have diabetes, but what it does mean is maybe your body is not efficiently using that insulin to convert your food into energy. And you have some extra glucose running around in your bloodstream. That can lead to what's called insulin resistance, which is a precursor to diabetes. Over time, that extra glucose in your bloodstream does damage your blood vessel and your kidneys. The third factor we look at is high triglyceride, and a triglyceride is a portion of the cholesterol. To be high, it needs to be at or above 150. Triglycerides are fat that circulates in your blood that does move around some nutrients that we need, but too much of it contributes to hardening of our arteries. Another portion of the cholesterol that we look at is the HDL cholesterol, and a risk factor is to have low HDL cholesterol. So for a man, less than 40, and for a female, less than 50 is considered a risk factor. The HDL cholesterol is sometimes called the good cholesterol because it's like the cleanup crew in our body. It takes all that excess cholesterol in our bloodstream and gets rid of it for us. The last factor we look at is your waist circumference. A large waist circumference is considered to be at or above 40 inches for a man and at or above 35 inches for a woman. A large waist circumference means you're carrying a lot of your weight around your abdomen, and that has actually been a larger predictor of premature death than your weight, your BMI, or your body fat percentage. It's important to note that waist circumference is measured around your belly button. It is not your pant size. So what do we do to help prevent and treat metabolic syndrome? So part of a healthy lifestyle is to exercise and get movement most days of the week, 30 minutes at a moderate pace. Another portion is to eat a healthy diet, and a healthy diet is watching your portion sizes, eating a variety of different foods, and having a balanced diet. Limit your alcohol consumption, 1 to 2 drinks a day for a man and 1 for a woman. Do not smoke. Manage your stress. Increased stress increases your blood pressure. And then pay attention to your waist size. Pay attention that your clothes are continuing to fit and not continually getting tighter. There are many things we can do to help you manage and treat metabolic syndrome. If you have any questions or want some advice, please do not hesitate to reach out to us at Rock Valley Health. Thank you so much.